Executive Secretary, Dr. Uzodimma.
Your Excellency, our beloved Governor, distinguished Senator Hope Uzodimma, Governor of Imo State, fully observed. I am going to cut this speech very briefly for want of time. The state is well established. On that note, we want to thank His Excellency for that personal gesture, and may God bless him. Today, Imo State is recording the highest single enrollment for basic healthcare provision fund in the country. Today, we have enrolled, and currently they have started assessing care 66,003 vulnerable population in Imo State. This is a record-breaking enrollment all over the country as of today. These 66,003 are all accessing care currently in the 305 wards in Imo State and 27 local governments in Imo State. As at April 3rd, we have activated access to care, and we are happy with the level of utilization. I'm happy also the OICs are here, they can testify that utilization has been very high. Part of what we are celebrating today is also the activity.
Working in the pilot LGA. Has received business plans from the facility and has also submitted an annual work plan to the National Plan disbursement of funds to the facility of the state. The Governor also in motion for the realization for approval of basic health care provision fund as pillar, which is the repositioning of health workers. God bless us all. Thank you.
Thank you, Reverend Sister. Next, in our program, World Health Organization representative. Your Excellency.
Loving Governor, distinguished Senator Hope Uzodimma, I salute you, sir. Thank you very much. I think Basic Healthcare Provision Fund is one of the most potent social security interventions in our journey towards the achievement of universal health coverage. The government released 100 million naira for this purpose at the inception of the program in the state. The Basic Healthcare Provision Fund is meant for the provision of a basic minimum package of health care services. The primary purpose of this fund is to ensure adequate and sustainable funding that will be efficiently and equitably used to provide quality health services and ensure financial risk protection in access to health services for all Imolites, particularly the poor and most vulnerable. The preparation of what we are witnessing today started in 2017 after the state paid the 100 million naira counterpart fund, and the State Primary Health Care Development Agency started preparations for service delivery. The Primary Health Care Development Agency identified one primary health care facility per ward in the 305 INEC wards of the state, and facility assessment was conducted in all these wards. When the result came out, 239 facilities were approved for Imo State to receive Basic Healthcare Provision Fund. As part of the preparation, the state opened a CBN TSA account for the gateways, while the facilities opened accounts in commercial banks. However, Imo fell short of starting the program with other southeastern states in 2018 because of lack of funding for the requisite training and capacity building. It was not until the emergence of distinguished Senator Hope Uzodimma, the health-friendly governor, that needed counterpart fund was released to ensure that capacity building workshops were conducted for the health workers at the state, LGA, and ward facility levels. In January 2021, His Excellency, Distinguished Senator Hope Uzodimma, funded the remitter utilization training of the agency accountants. And in March the same year, Imo State Primary Healthcare Development Agency got the first tranche and authorization for utilization of our basic healthcare provision funds. In September 2021, with the permission of our health-friendly governor, the 226 accredited facilities in Imo State received the first basic healthcare provision fund disbursement of 600,000 each, which were for the last 2 quarters of the year. The funds were used for the preparation of the facilities for the commencement of service delivery. In 2022, His Excellency Distinguished Senator Hope Uzodimma, the Governor of Imo State, magnanimously commenced the renovation of 1 primary health care per ward to also improve their infrastructure and equipment status for the commencement of service delivery in the rural communities. Earlier, His Excellency Distinguished Senator Hope Uzodimma, the health-friendly Governor of Imo State, funded the training on business plan development and fund retirement of officers in charge of health facilities and World Development Committee chairmen who are signatories to the facility account. Also in 2022, with the approval of our dear Governor, 80 ad hoc midwives were recruited and deployed to bridge the human resources for health gaps identified in the primary health care facilities. These midwives are in the facilities offering services to improve maternal working in the pilot LGA. The has received business plans from the facility and has also submitted annual work plan to the National Plan for disbursement of funds to the facilities in the state. The Governor also in motion for the realization for approval of basic health care provision funds. Last pillar, which is the positioning of health workers.
Thank you, Reverend Sister. Next, in our program, World Health Organization representative. Your Excellency, I am representing Dr.
Comment on me the traditional title of Ochendo I of Imo State on my first visit in August 2020. Between WHO and the state, and by extension the whole country, as that was in the middle of the COVID-19 pandemic. Let me first appreciate Your Excellency for the priority accorded the health sector in the state through building and renovation of primary health care centers, general hospitals, the purchase of 10 mobile clinics, recruitment of over 80 ad hoc midwives for the basic healthcare provision fund, payment of counterpart funding for renovation of the State Central Medical Store, and sponsorship of the Imo Medical Mission with over 300 beneficiaries, including open heart surgeries for babies with congenital heart defects. This support you have provided to the health sector in the state has found its expression in key milestones, and I will just mention two. Number one, Imo State is leading the Southeast Zone in COVID-19 vaccination, moving from 5% in February 2022 to 68% in March 2023, moving from the 31st position to the 14th in the country. The second is a local TB really request of the state government of establishing this functional health insurance program, with the committed to providing ongoing technical support to ensure our poor and vulnerable. Your Excellency, of an enabler of poverty reduction an economic increase in real GDP, and 200% increase in number of jobs created over a 5-year period. Universal health coverage benchmark of at least 8%. Only huge economic benefits while guaranteeing that the benefit package is robust to cover primary security in the state. That health insurance cannot be effective without provision of quality health services. To achieve universal health coverage and the SDGs in the state, the appropriate quantity and mix of healthcare personnel is vital. WHO recommends up to 4.45 skilled healthcare workers, and this includes physicians, nurses, and midwives for 1,000 population in order to achieve the SDGs. At present, healthcare worker per health services needed by the people, including primary healthcare under one provision fund, and setting up the stages in the private sector and faith-based institutions will complement and indeed drive decision-making. It's how to generate appropriate evidence from spreading to existing health platforms. Ladies and gentlemen, the WHO, as you are aware, is by addressing its root cause. Number 2, it's a radical reorientation of health system towards primary health, which urgently strengthens as underpinned by strong governance and financing to ignite.
Okay, my name is Mrs. Stella Okafor. We appreciate Governor for all he has been doing for us, mostly for this Flagoff. And in fact, if I must express my feelings, he has been doing so many good things to us. Even I heard that he said that he's going to pay gratuity to our pensioners. With this alone, Governor has done noble to us in Imo State. My name is Mrs. Stella Okafor. I am from Olo local government. I appreciate him.
Okay, my name is Mrs. Uzodimma from Ministry of Trade and Investment. In fact, I'm happy to be here today about what is happening. This has been the first so far, and we pray that God will continue to guide and protect our governor to do more in Jesus' name. My name is Mrs. Uzodimma.
Before the coming of your administration, and how with effective and immediate attention you will lead funds and make sure that everything that is needed to facilitate the process of ensuring that access to healthcare through both the basic care provision fund, through the health insurance authority that we are here to unfold, and also through the primary healthcare, state primary healthcare development agency, are all giving the necessary attention. Your Excellency, this can only be done because of the love you have for the good people of Imo State. But as it increases day by day, you will continue in this light, sir, at ensuring that the people of Imo State get the best of health services and other services that they so desire from your administration. Thank you, sir. Of Health, my colleague minister, Dr. Sage Ehanire, and indeed the President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR. I wish to congratulate you, Your Excellency, the Executive Governor of Imo State, and the good people of Imo State on this historic event, marking the activation of access to health care for universal health coverage in Imo State. This is a remarkable and laudable achievement for any government, and a giant stride, political milestone for the Imo shared prosperity government of Senator Hope Uzodimma and the APC government. Mandate towards the global universal health coverage drive, which the Nigerian government have taken full responsibility. Suffice it to say that as a government, the signing into law of the National Health Insurance Authority Act 2022 and the National Health Act of 2014, we are committed
to ensuring the provision of healthcare services and financial risk protection to all Nigerians. And this is what His Excellency the Governor is really doing for the people of Imo State. We thank you, sir. Primarily, we are concerned, among other things, the three broad objectives of universal health coverage, which are equity in access, where everyone who needs health services should get them, and not simple those who can pay for them. Quality health services, good for to improve the health of those receiving the services. And thirdly, financial risk protection, which is aimed at ensuring that the cost of healthcare does not put people at risk of financial hardship. These are compelling concepts of our administration and key areas of progress and prosperity in healthcare delivery in Nigeria and Africa at large. Your Excellency, the Governor, I want to once again congratulate you on the enrollment of 60,003 beneficiaries of the Basic Health Care Provision Fund, meant for the poor and vulnerable groups in Imo State, and the access of health care that they have started enjoying. The Ministerial Oversight Committee of BHCPF are aware of this great feast recorded within the past few months and appears to be the largest single enrollment in the country so far. We commend you, sir, for this great effort. The delivery of all these people-oriented programs, the essential health services, and protecting people from financial consequences of paying for health services out of their own pockets reduces the risk that will push them into poverty. An intervention such as this activation to care for universal health coverage is apt and highly commendable. I am very delighted that this activation of access to health care includes the formal sector health insurance program for the state civil and public servants and local government employees as well. These efforts by your government complements the federal government's determination in ensuring easy access and quality healthcare service delivery in Nigeria. I am certain that the good people of Imo State will be grateful for this determination of your administration to improve on their health well-being. Yes, sir, ladies and gentlemen, the government of President Muhammadu Buhari, GCFR, is aware of your mission to spread development and fast-tracking industrialization to a healthy workforce to the good people of Imo State, despite the daunting challenges in administration. And you have stood tall above metrics of assessment in the standards and quality infrastructural works. You have been able to put in place in the state. History will be kind to you, sir. And I once again say congratulations. Finally, let me express my gratitude to all the developmental partners working in Imo State for the strong technical and material support given to build the state health care system and Nigeria at large. To our major stakeholders, the health workforce in rural and urban areas, you are highly appreciated for your service to the people of Imo State and to our fatherland. We sincerely appreciate your sacrifice of love. To the beneficiaries, I congratulate you and urge you to make effective and efficient use of this gracious opportunity for the growth and development of Imo State and our country at large. Thank you, Your Excellency, the Governor. Thank you, the good people of Imo State. May God bless our dear President, His Excellency President Muhammadu Buhari. May God bless the Federal Republic of Nigeria. May God bless us all. Thank you.
I want to start by first thanking the Almighty God for making this day possible and for bringing all of us to be alive and strong to witness this day, a new day in our life, a day that is going to be remembered in history as the day a partnership between federal government, state government, local government was able to construct and bring access to quality health care to both the rural dwellers, the urban settlers, and indeed members of the elitist class. I want to congratulate the President, President Muhammad Buhari, for his passion and care to the ordinary man on the street. I want to salute his government for the various social interventions he created as a president since 2015. I want to congratulate our development partners, WHO, National Health Insurance Agency, National Primary Health Care Development Authority, and the representatives of the OICs, those who are here today and those who are not able to make it, for the constructive and genuine partnership they have extended to Imo State. In our quest for a new Imo, in every arrangement and struggle to make Imo State to have a meaningful life once more, to build prosperity, to make an average Imo individual be proud to say, yes, I am from Imo State. It became necessary and obvious that given the lean resources available to the state government and local government, that the only way we can achieve our desire is through collective effort. And this collective effort that allows for synergy and partnership is the only thing that can work. To the glory of God, our development partners, the federal government, rose to the task. And here we are today. I want to congratulate the Imo civil servants. I was able to find courage to take this very bold decision, knowing the cost implication. But I think that there is no way without health. Every Imo civil servant that is properly insured under this program, apart from cancer, will be treated of any sickness, will be taken care of, including routine medical checks. Because according to experts, preventive medicine, which is the best form of medicine, can only be gotten if you submit yourself to routine medical checks. So today, if this program has conceived and being flagged up to this task, we can beat our chest and say, yes, Imo State have a clean bill of health. Not only the citizens, but those who are working for us. Unfortunately, if my people are healthy, if my people are happy, it is only then and then alone we once say that Imo State is healthy and Imo State is happy. We will continue to support you. We will capitalize ideas. We will also hide under this program to reduce the unemployment that is currently in our state. The more medical centers we have, the more nurses we will employ, the more administrators we will recruit, and the more jobs that will be created. So we can buy one and get two or three. So on behalf of my family, the government and people of Imo State, I want to thank once more federal government under President Mohamed Buhari, the WHO and other governmental partners, the state government and the local government authorities, and those of us who are well-wishers. Africa will only survive if we can rise, copy other parts of the world, and follow that route that brought them to greatness. May God bless all of you. Thank you.
Okay, my name is Joseph Ekmakama. Well, I saw an environment that was prepared, ready for the things that we are witnessing at this very point in time. You know, health is life. So I saw people who, even with the rain that delayed the activity from kickstarting and the other activities that the governor was engaging, who patiently waited from the time to this very in the morning to this very hour. So I saw people and the government that is committed at ensuring that the best is given to the people of Imo State in terms of health well-being. So it's actually an encouragement because this is what we desire. This is what the President of the Federal Republic of Nigeria desire. That's the essence of his vision and mandate for universal health coverage for all Nigerians. So what we are seeing here is a duplication of what the federal government through the President is doing. The governor has done marvelously well at ensuring that every Imolite get the best of health services. And this access of health care services is key to it. Yeah. Thank you. Joseph Ekmakama, Honorable Minister of State for Health. Thank you.
I am Dr. Eke Jonathan. I am representing the Director General of the National Health Insurance Authority at this event. It's great. That's what we've been asking most of the governors to do. I'm so proud that we're showing the political leadership that is needed in our march to universal health coverage. And what he's doing today, in fact, we are very, very happy. And we will always support that to make sure that we get to our destination. I'm Dr. Eke Jonathan.